Hello friends, welcome to my channel Made Insight. How to start reading ECG. In this video we will discuss how to approach the ECG reading. For that, you should know the important components of ECG to reach the final diagnosis. First, make a habit to read ECG systematically. Do not directly jump to diagnosis. With experience, you will definitely give diagnosis in one glance. Important components of ECG. Patient data. To report a 12-lead ECG, you should check primary details of patient data. Patient data includes patient name, age, sex. Patient work profile, patient presenting complaint. Why ECG advised? Relevant past medical history, relevant ongoing medication. Technical data. You should check date and time of recording, paper speed and calibration and technical quality of ECG. Then actual ECG reading starts with basic fundamentals of ECG, that is rate, rhythm and axis. Then comes details of ECG like P wave, PR interval, Q wave, QRS complex, ST segment, P wave, QT segment and U wave. Why patient data important? The ECG changes rapidly from birth through childhood, with age differences clearly related to increasing QRS voltages and a widening QRS complex. QRS duration is longer in males than in females. Similarly, bradycardia is common in athletes and heavy exertion workers. Bradycardia is common in old age patients due to ischemic heart disease, due to sick sinus syndrome, and in hypothyroidism. Patients presenting complaints like chest pain, exertional breathlessness is important if we are suspecting anginal symptoms or ischemic heart disease. Patient complaints like palpitation can hint towards arrhythmia or disease like hyperthyroidism. Patient medication history. Antihypertensive medications like beta blocker can cause bradycardia. Similarly, diuretic medications can cause electrolyte imbalance and cause arrhythmia or changes like T wave in hyperkalemia. Technical data of ECG. In standard 12-lead ECG, normal paper speed is 25 mm per second and a gain setting is of 10 mm per millivolt. Quality of ECG should be good with no vibration. This is overview of ECG reading. In next video we will learn basic fundamentals of ECG like rate, rhythm and axis. Thanks for watching. Please do not forget to subscribe the channel.